Severe allergic reaction anaphylaxis medication administration. Things to consider. Identify symptoms of a severe allergic reaction as indicated on emergency action plan if possible. These may include obstructive swelling of the lips, tongue, and/or throat, trouble swallowing, shortness of breath or wheezing, turning blue, drop in blood pressure, feeling faint, confused, weak, passing out, loss of consciousness, chest pain, a weak pulse, and/or a sense of impending doom. Given that when a child is having a severe allergic reaction, it can be a stressful situation, it is highly recommended that you familiarize yourself with the student's severe allergic reaction emergency plan beforehand. If your school participates in a stock epinephrine program, be sure to know your school's plan and protocol regarding stock epinephrine administration, know the storage locations of the stock epinephrine, and have proper training to administer the stock epinephrine. Your school nurse or other licensed healthcare professional must review the epinephrine administration procedure with you to ensure that you have the skills to perform this emergency medication administration. Store the severe allergic reaction emergency plan and epinephrine autoinjector in a location that is easily accessible during a severe allergic reaction. Be sure to check the expiration date on the medication package to ensure that the medication is not expired. Also, make sure that the medication is clear and replace the medication if it is discolored. As this is an emergency situation, it is important to act quickly while ensuring everyone's safety. Procedure for administration of epinephrine autoinjector. Identify that symptoms of a severe allergic reaction are present and that based on the child's severe allergic reaction emergency plan, medication needs to be given. Call for assistance. Ask that another school staff personnel call 911 or emergency medical services and notify parent. Remove other students from the area as necessary. Gather needed supplies and place on a clean surface near the student. Quickly talk to the student and evaluate the situation. Prepare the student. Quickly review the medication administration form, the medical provider or district protocol plan form, and the parent-guardian consent form if available, as you review the 5 rights of medication administration. Check the epinephrine autoinjector and order to be sure it is for the right child, the right medication, the right dose. An approximation of the child's weight may be needed if using a stock epinephrine autoinjector. Being given at the right time and being given by the right route. Be sure to check the medication to ensure that it is not expired. Wash your hands if possible. In a true emergency situation, there may not be time to do this step. Put on gloves. Quickly review the 5 rights once again while checking the epinephrine autoinjector to be sure that it is for the right child, the right medication, the right dose. An approximation of the child's weight may be needed. Being given at the right time, and being given by the right route. Medication administration instructions for EpiPen. Remove the EpiPen autoinjector from the container. Remove the blue safety guard from the pen. Firmly press the orange tip against the student's mid-outer thigh until click is felt, and then hold for 3 seconds. The pen can be given through clothing in most circumstances. Remove and massage the area for 10 seconds. Replace the pen back into its container and place it into an appropriate sharps container or hand to emergency medical responders. Adrenaclick administration. Remove the Adrenaclick injector from its container. Remove the caps labeled 1 and 2. Firmly press the red rounded tip down hard against the student's mid-outer thigh until the needle penetrates and hold for 10 seconds. The injector can be given through clothing in most circumstances. Remove from the thigh and massage the area for 10 seconds. Take precaution with the exposed needle while replacing the injector back into the container. Dispose of the injector into an appropriate sharps container or hand to emergency medical responders. AVQ. Pull AVQ up from the outer case. Pull red safety guard down and off of AVQ. The red safety guard is made to fit tightly. Pull firmly to remove. To reduce the chance of an accidental injection, do not touch the black base of the autoinjector, which is where the needle comes out. If an accidental injection happens, get medical help right away. Place black end of AVQ against the middle of the outer thigh. Then push firmly until you hear a click and hiss sound and hold in place for 2 seconds. Place the used AVQ into an appropriate sharps container or hand to emergency medical responders. SYMJEPI autoinjector instructions. Pull cap off to expose needle. Handle the device carefully to avoid an accidental needle stick. Holding by the finger grips, slowly insert the needle into the thigh. The injection can be given through clothing. After needle is in the thigh, push the plunger all the way down until it clicks. Hold in place for 2 seconds. Remove needle and massage the area for 10 seconds. Note: the correct dose has been injected if the plunger has been pushed all the way down and the solution window is at least partially blocked. Upon removing the needle, be cautious of exposed needle and take care to avoid an accidental needle stick. While holding the plunger end of the syringe with one hand, use your other hand to slide the safety guard up until it clicks to cover the needle. Place SYMJEPI autoinjector into an appropriate sharps container or hand to emergency medical responders. Post-medication instructions. If alone with the student and you have not already called 911 or emergency medical services and notified parents, do so now. Monitor students' pulse and respirations. Once the emergency medical responders arrive, inform them of the medication administered, including the type of medication, dose, and the time given. If not done already, dispose of the injector in an approved sharps disposal container or give to the emergency medical responders. Remove gloves and wash hands. Document medication administration in student's medication administration log. Follow up with the parent or guardian and healthcare provider as needed.